What if I told you? There was a time in history when doctors believed they could cure mental illness by removing a part of what makes you. You? No therapy, no medication. Just a simple procedure that could turn a violent patient into someone completely calm in just a few minutes. Sounds like a miracle, right? But what if I told you this miracle often didn't cure people? It erased them. Let's go back in time. The year is 1935. The world is very different. Mental health isn't understood the way it is today. If someone was depressed, anxious, or hearing voices, they weren't sent to therapists. They were locked away. Asylums were overflowing. Thousands of patients, screaming, crying, completely lost in their own minds. Doctors were desperate. They needed something, anything that could bring these people back to normal. And that's when one man stepped in, a Portuguese neurologist named António Egas Moniz. He had a radical idea. What if mental illness wasn't something emotional, but something physical? Something wrong with the brain's wiring itself? Moniz believed that certain thoughts, obsessions, fears, hallucinations were caused by faulty connections in the brain, specifically in the frontal lobes. Now think about that for a second. The frontal lobes are responsible for decision-making, personality, emotions, behavior. Basically, they help define who you are. And Moniz thought, if we can just cut those faulty connections, we might be able to reset the brain. So, in 1935, he performed something completely new, a procedure where he drilled into the skull and destroyed parts of the frontal lobe connections. He called it leucotomy. Later, the world would know it as lobotomy. At first, the results seemed promising. Patients who were once violent became calm. People who screamed all night suddenly sat quietly. Doctors saw this and thought, this is it. This is the cure. But here's the problem. They were only looking at the surface. Yes, patients became calm, but not because they were cured, because they couldn't feel the same way anymore. Imagine this. You're extremely anxious. Your mind is racing. Your thoughts won't stop. Now suddenly, that part of your brain just stops working. No anxiety, no fear, but also no excitement, no joy, no personality. It wasn't healing. It was disconnecting. Despite the risks, this procedure spread like wildfire. Hospitals across Europe and America started performing lobotomies. Doctors were overwhelmed with patients, and this was fast, simple, and seemed effective. In fact, by the 1940s and 1950s, tens of thousands of people had undergone lobotomies, and then something unbelievable happened. In 1949, António Egas Moniz was awarded the Nobel Prize. Yes, a Nobel Prize for a procedure that would later be called one of the darkest chapters in medical history. But the story doesn't stop there. Because another doctor took this idea and made it even more extreme. Instead of drilling into the skull, he found a faster way, a much faster way. He would take a sharp, ice pick-like tool, insert it through the eye socket, and hammer it into the brain. Then move it side to side, cutting connections in seconds. The entire procedure could be done in under 10 minutes. No full surgery, no complicated setup. And because it was so quick, it became even more popular. At first, families were hopeful. They saw their loved ones calmer, quieter, less aggressive. But slowly, they started noticing something strange. Their loved ones weren't the same anymore. They didn't laugh like before. They didn't react. They didn't care. It was like the soul had been switched off. Some patients became emotionless, childlike, completely dependent. Others lost the ability to plan, think, or even speak properly. And in some cases, they didn't survive at all. As time passed, more and more cases started surfacing. Families began speaking out. Doctors began questioning. And researchers started looking deeper. The numbers were disturbing. Only a small percentage of patients actually improved. Many were left permanently damaged, and some paid with their lives. The 85% success rate that was once claimed started to fall apart. Because success didn't mean healing, it meant the patient is easier to handle. By the late 1950s, something changed everything. New psychiatric medications were introduced, safer, more effective, and most importantly, reversible. People finally realized there was no need to destroy the brain, to treat the mind. Gradually, lobotomies were abandoned. Hospitals stopped performing them. And what was once celebrated as a breakthrough became a warning. But this story leaves us with something deeper, a question that still matters today. How far should we go? In the name of curing something. Because think about it. Doctors weren't evil. They were trying to help. They were desperate. They believed they were doing the right thing, but in that process, they crossed a line between healing a person and changing who they are. Your brain is not just an organ. It's your memories, your emotions, your identity, and history has shown us that even with good intentions, if we don't fully understand it, we can do more harm than good. Maybe the real question isn't, can we change the human mind? But rather, should we? Because once you erase what makes someone human, there's no bringing it back. And that is the true story of lobotomy. If this made you think differently, stay curious.